And I say to my mind, calm down.
Yeah, but first of all, you're stressed. You think you're afraid of the blood pressure machine, so it's off the Richter scale.
Yeah,
and then you sit there and you breathe and you take it 15 more times and you get it down to like really calm, really normal.
That's my biofeedback machine. You didn't know it.
Yeah.
You know, I'm going to take the hot light off of me and put it on you for a minute, because you were dead, right? I mean, that's putting it pretty bluntly, but you were actually dead at one time, and they put those electric things on your...
I had 10 cardioversions. I had a cardiac arrest, required 5 rounds of CPR, broken rib from it, and believe it or not, I didn't have a heart attack. I had a healthy heart. Okay,
so why did that happen
as plumbing goes, I had a genetic thing where I had rhythm disturbances, and my heart would start beating 200 or more for just, you know, I used to try and control it, thinking I was doing something wrong, you know, that if I could only be calm, that if I could avoid coffee, if I could avoid being overtired. I kept thinking all of these external things were causing my heart to go off. And I got, you know, I came to a point, the episode started at about 28.
28, you were 28 years old.
My dad was 30 when he had the same thing. My brother was 30, 32, and my son, who's now 34, has the same thing. And there's some pretty good research out there linking sick sinus syndrome and atrial fibrillation as a genetic abnormality. They found actually the place on the chromosome that's messed up. And so I was to the point where they kept doubling, tripling, adding medications. I was on 13 cardiac medications, and doctor said, if you don't have something done, you're going to drop over dead. And so I had what's called an ablation procedure, and they went in, there were 50 spots where the electrical signal got messed up in all 4 of the veins that come off of my heart. Very easy procedure, but a life-giving. I went from not being able to walk to the mailbox.
You were dying.
Yeah, I was dying. Yeah, they said, and what happens too is the top chamber, your left atrium, just keeps getting bigger and bigger and bigger because it isn't functioning properly, and your heart just becomes so enlarged that it doesn't work.
Okay.
Well, mine's back down to normal size. I lead a pretty normal life. So
you sure do. And that's why we're doing this show. And again, maybe you can kind of
well, that our first joint venture actually involved helping a woman to get an ablation, a third ablation procedure. We had gone to a social event, and there was they were basically people kind of our age, but there was this young woman there, and I talked to her, a little bit of casual talk.
She talked to me.
And so then she came to you, though, and she said, my life is over.
Yeah,
she said, I've had 2 heart operations, I can't drive, I've had to give up my job, I've had to come home, I'm living with my mother now.
She was totally depressed because of her heart ailment. She lost her job, she lost her everything, and she was so distraught. And so she came to me, and mentally, what am I going to say to a person like that? So then you stepped in.
Yeah, and you said, look, talk to Mary.
Talk to Mary. She's the patient advocate here. Yeah,
and so anyway, she was very determined that she wanted, they had an appointment set up with an electrophysiologist, which is a cardiac specialist. She'd gone through 2 procedures which had been unsuccessful. And by the way, I went through one unsuccessful procedure, one that lasted only 14 months. And so, and I checked out the doctor they had the appointment with. It was somebody at a major medical center, fairly reputable, and I began to talk to her mother, and her mother says, I want to go to the doctor that you went to. And I said, well, I think Sandy's condition is a little bit different, but I'm perfectly willing, you know, you can go get an opinion from the cardiologist. They did, and within 2 weeks she'd had a 3rd operation and her life restored.
So you're saying she had we went to the same doctor that saved your life?
He did a little bit different procedure on her, but he made her so that she stopped having these episodes where her heart raced and she couldn't drive, she couldn't work, she couldn't do anything. Right. She got her life back, just as I did.
So for me, the real truth is, you know, you can start out to have a mental disorder like bipolar or alcoholism or drug addiction, and you can just keep using the self-medication and use it and use it and use it and never find out what the solution is. And there's always a solution.
Right.
There's always a solution. And that's what the show is going to be about. Well, you know, that's why I would say if anybody would like to get in touch with us, and we would love to help them out, and for the psychological and
the phone number and the contacts are going to be, you'll see them on the screen at the end of the show, and we would love to hear from people.
But anyway, getting back to how many people have you helped in the medical field?
Well, I started, I'll go back to my childhood.
5 years old, right? You started wanting to be an MD at 5 years old.
About 5. I can remember the library in the town where I grew up, and I was a voracious reader. And I had read all the children's books, finished that side of the library, and I moved over to the other side, was fascinated, and I started reading. I had a chemistry set at 7 years of age. I was reading chemistry books, physiology books, anatomy books. I was reading all of these. Well, I was still in elementary school.
Wow.
And so by the time I was 7 or 8, I pretty much knew that I wanted to go into medicine.
Right. And how old were you when you knew that?
Probably 7 or 8.
7. That's amazing.
And never thought of anything else. I worked a few little jobs. I packed hardware parts the first summer, I guess, as I graduated from high school. Then the next summer I was working in the hospital. I got a job in the hospital.
The medical life you started.
Yeah, right. When I was 17, I learned a lot about pathology. I learned a lot about clinical lab testing at the time. Just learned a lot. Got into pre-med at 16.
Okay.
And
and we got to stop you there. You got 16 years old. You went in UCLA.
Correct.
For pre-med. That is amazing. You know, I didn't know what I wanted to do, be a therapist, until I was 30 years old.
Yeah. And so at that time, number one, there were very few women MDs.
Why is that?
They were.
It's a man's world?
It was a man's world. There were
I'm going to get all the women upset out there, but that's true.
Well, I have interviewed women MDs who are in the older range, and they typically were the daughters of doctors.
Okay.
There was a time in this country where the doctors sent their sons and sometimes their daughters, if they were so inclined, to medical school. But at the time I went to school, I'm not a youngster by any means. There weren't the student loans that we have now, and so I didn't have financial backing, and it's pretty hard to keep up your grades in chemistry and physics and all the things that you have to take, and work. I always had to work.
You can't do it. You can't do the medical. That's a horrible, hard situation, and then make a living at the same time. So what happened? So
ultimately, I wound up just going to school part-time. I found out that I could make a living by typing reports for doctors. I was always, and then I started doing research for them.
But it's still all medical.
Still all medical. I never did anything but medical. Never had any interest in and so then I was still going to school, had a contact from a hospital that I had done some work for, and they were looking for somebody to do a teaching program and do all of their paperwork, their medical documentation.
Wow.
In fact, my business was called Medical Documentation Limited, and so I wound up teaching the doctors, assessing records, teaching women medical terminology, or even such things as going through the admitting office, seeing that those women had the proper setup to.
You're very brilliant. I'm going to give you a compliment, because when I see you using these big, giant medical words, but truly, it was your whole life.
Yeah. Then went on. I had a contract with the Department of Rehabilitation, Human Resources. I love teaching. I love seeing people who had no training to do anything become proficient and be able
to help people
to launch a career. I love seeing people get proper medical care, making referrals.
And what really amazes me is you still are out there with this positive attitude.
Right.
I mean, even when you were dying, you were working full time. You had a positive attitude. You were helping your both sons raise their kids, and you never give up.
No.
Where I get hysterical.
You're the psycho.
I'm the psycho, and so we make a good team if we can, stay.
If we can, you know what? One of my favorite words now, I think, is balance.
Balance.
And if we can find balance in our lives begin to work. And that's, you know, no matter where we're at, so that you're not off on one tangent or another, but that you've got balance in your life. That goes for eating, health care, psychological, everything is, you know, our recreational activities.
Yeah, it's all
we
balance.
have a balance that we're not all out of whack.
You know, let me tell you a little secret that I use. Even the word God, which I didn't like that word for a long time because of my Catholicism and all that, but now I call it good, orderly direction, God.
Yeah.
And that's what you're saying, a balanced life.
A balanced life.
So we're going to be teaching that. And we're going to be getting guests that have horrible problems on the air.
Yeah.
And we're going to be creating a solution.
No, that's, you know, that you bring hope is what that's our mission. That's our purpose. We're going to talk in future shows about things that we've had personal experience with. You with your patients with bipolar, schizophrenia, depression, alcoholism, drug addiction. And we now have expertise in prostate cancer.
Eating disorders. Yeah, now
eating disorders. Yeah. I have a huge fund of knowledge about cardiology. You've gone through hip replacements. We can help people with orthopedic problems.
We're just about out of time, but I just want to mention one last important thing for me. We really want to help people that have lost their homes, that have no hope. We want to talk to those people, and we want to both give them mental and medical help. And that is the whole intention that I have of doing this show, helping a lot of people.
Yeah.
So I think we're just about out of time. We are out of time. I'm going to wrap it up. Thank you very much for being my co-host. I'll get that right this time. Mary Joy.
Thank you for having me here.
And
it's been quite an experience.
Yes, it was. And ladies and gentlemen, just remember, keep the faith and trust in God, and everything will work out. Be peaceful and have a balanced life. Thank you very much. See you next time. My name is Dr. Lee Fitzgerald.